we're going to do is Dr. Skul is going to come on soon, and she's going to share with you about all this awesome information and educate you on women's hormonal changes and the symphony of it all. And then after that, we're going to do a Q&A with Dr. Skul. So here she is, Fabienne. I'll give you the reins.
Yes, Dr. Skul, hello. Thank you so much for being with us and for your patience through the introduction. We're so excited to have you tonight. And let me tell you a little bit about Dr. Skul. She is the founder and the medical director of the Comprehensive Center for Women's Medicine, a multi-specialty holistic medical practice for women in Chicago. Through her work with the leadership of the American College of Physicians, she has helped shape guidelines for educational requirements of internists through all of the nation's medical universities. This earned her, among many other teaching awards, the college's highest recognition, the Laureate Award. She was ranked as one of the nation's top doctors by U.S. News. She avidly supports organizations empowering girls and women and protecting our environment. Thank you so much for being with us.
Yes, thank you for being here.
Thank you so much, Fabienne and Pearl. I feel so honored to be with you on this evening when we've just heard from wonderful organizers and co-hosts of the upcoming summit, and I will make sure to share it with many of my patients and colleagues. I am really privileged to be here and look forward to our chat tonight.
Yes. So, did you share, Pearl, about the raising hands if people have questions and things like that afterwards, or if they can write? Yeah?
Yeah, I am just about the questions box, yeah. If you have a question, like I said, just put it in the questions box, and we'll answer those at the Q&A tonight.
Great. Dr. Vesna, could you please describe your practice with us and share about your experience with patients with thyroid disease?
So, like I said, again, gratitude for being here. Thank you for having me. The practice that my partner, Dr. Hoyer, and I share in Chicago has been built on 66 years of joint experience. I was allopathically trained as an internist and boarded in internal medicine, but soon after that, in the mid-80s, felt that I really wanted to specialize more and work with women, so additionally trained in women's health. And as it became apparent to me within the first years of practice that my style and my approach to healing patients was very different from the traditional American style of disease-based medicine, I sort of started delving into ways in which to integrate aspects of ancient medical practices, collaborative approach, as was mentioned earlier, partnership with other practitioners, which led to fellowship training and board certification in anti-aging and functional medicine. As such, and you know, looking at my career, I really don't think of myself as an expert in this field, but I think of myself as a perpetual student, because every patient and every colleague collaborator teaches me something new. There's a pearl added to my toolbox to help the next patient and the next patient achieve their optimum health. And my hope really is that as I work with patients over time, I really make myself obsolete. So empowerment of women to practice what I call self-sustainable health through education and partnership is how my practice functions. So my experience with patients with thyroid disease has been paralleling the experiences of nation with thyroid disease and autoimmune disease on the rise, and quite frankly, if you look for it, it's there. We just need to identify it and uncover and unearth the most common chief complaint in a primary care physician's practice is one of fatigue. And underneath that blanket complaint certainly lies a patient with a thyroid problem or many of the other hormonal imbalances that we're going to talk about as the conversation evolves.
As you mentioned, you were seeing a rise in autoimmune disease in your patients today in the last 3 decades. So what do you attribute this to?
Well, look around us. We live in a world that's driven by stress and toxins. Our patients, particularly younger women, are balancing very fast-paced lives, balancing their work, juggling careers with personal and family issues. And then those of us in the sandwich generation are caring for the elderly aging parents, worrying about the teenagers or the millennials in our lives. And combine that with roller coaster of perimenopause or menopause, you have a perfect situation of heightened stress and challenges. On the toxin side of things, CDC has registered more than 87,000 toxins since World War II, and we're exposed to them every single day in an abundance and rates much greater than afflicted our grandmothers throughout their entire life. From the air we breathe, the water we drink or shower in, to the food we ingest, the cosmetics we use, the lifestyle habits, including these, and electrosmog and radiation caused problems are all integral part of this emergence or increase in autoimmune disorders, cardiometabolic problems, infertility, and neurodegenerative issues, that all of which are presenting into a practice of a primary care practitioner every day.
Yeah. Could you please describe a typical thyroid patient that you see?
Well, as I mentioned earlier, just about every patient that enters through the door is a potential thyroid patient, but most are fatigued. And as fatigue can be multifactorial, it's imperative that a thorough history is obtained. And I like to start by asking my patients if they could recall the time when they last felt great. And then kind of from their answer, we create a longitudinal timeline and a story. And many of these stories have very similar underpinnings, as they are often very precisely identifiable triggers that may have started the onset of the thyroid disease per se. I feel that we think of thinking of hormonally turbulent times like puberty and adolescence, then peri and postpartum period, peri and postmenopausal times when women are on hormonal contraception. So many of our patients are struggling with consequences of hormonal challenges, whether physiologically or induced. Many patients come and are struggling with weight. They have absolutely tried every diet in the book, every exercise trick, and or visited every personal trainer, and are unable to shed the pounds despite trying their hardest. They've tried every green detox, they've tried every fad diet, they have basically gone the gamut, and they're still challenged by inability to lose weight. They all complain of some degree of skin and hair issues, whether the hair is thinning or falling out in chunks, or skin is drinking gallons of moisturizer and still feeling dry and rough. It's all there, But let's not forget the digestive issues. Whether they're bloating and food intolerances or frank constipation and very serious problems, sometimes landing them in the emergency room. So that's a typical de novo patient that you always have to think about thyroid when they present with any of those. But another very common patient in my practice, which sort of draws patients who are seeking integrative practitioners, are the patients that are diagnosed with autoimmune hypothyroid disease, but who were told that, you know, they need not worry about those antibodies. Once they're always there. They come in with perfect labs in the box, as they call them, having been started on thyroid replacement with conventional physicians, and they started feeling better, but now they're crashing, and everything on paper looks perfect. So that's the other category of the patient that we often see.
Can I ask you a question? What came up to me when you were sharing about the menopause and everything? What causes early onset menopause, like women in their mid-30s to late 30s?
So I think we are seeing not only the changes in the onset of menopause in some instances, but we're seeing a huge increase in infertility, and that may be interrelated. It is all predicated, in my opinion, by an autoimmune challenge that those individuals have. So by definition, even in the conventional medical terms, menopause before age 40 is considered premature. By and large, that is an autoimmune disease until proven otherwise, and those patients frequently come to me with other autoimmune conditions. Thyroid, always sought and frequently found, polycystic ovarian syndrome, GI stuff, celiac problems. So again, whenever I see a young woman going into the perimenopause, menopause before age 40, I always think autoimmune, and let's look for other comorbid conditions in that type of a patient.
What is then your approach for treatment,
So basically, you know, we obtain, after history is obtained, I review the data they frequently bring along. And believe it or not, in 2017, when so much is known about how to properly diagnose thyroid disease, many of my patients still come with basically just, you know, bare bones basics, chemistries, and a TSH, thyroid stimulating hormone. And based on that information, which often reveals the thyroid stimulating hormone to have been elevated, originally elevated and then subsequently normalizing because their prior practitioners started them on treatment with Synthroid or several of its generic equivalents. But there is no vitamin D levels, there's no nutritional analysis, no other hormonal evaluations. However, all of that would be considered within the realm of traditionally acceptable medical evaluation of a patient with thyroid issues and appropriate treatment. Well, we obviously know that that's far from being true. So we will then obtain the TSH, the free T3, free T4, reverse T3, thyroid antibodies, TPO, or thyroglobulin antibodies. But I always like to consider and frequently obtain 4-point cortisol, 4-point salivary cortisone for adrenal evaluation, because adrenal fatigue and hypothyroidism are frequently seen together, and it is not easy to clinically differentiate the two. So treating the thyroid without understanding that there might be adrenal underpinnings may be the worst thing to do for a hypothyroid patient. They may have an initial improvement in their symptoms when exogenous thyroid hormone is provided, but they frequently crash and because their adrenals are now on even greater overdrive with supplementing with thyroid hormone. Now, I don't really want to be misunderstood as either arrogant or uninformed when I say that it is almost irrelevant what replacement therapy is recommended, as you know, it may vary from patient to patient. And I sometimes have to change medications in the same patient until we hit the sweet spot for replacement. However, you know, if there is a skilled compounding pharmacy around and partnering with a compounding pharmacist to compound our hormones for optimization of individualization of treatment is really my preference. But, you know, honestly, unless or until we look at the root cause of the problem to begin with, it really is far less relevant what medication we give the patient, because they're not going to get better unless we look at the toxins and their nutritional deficiencies and therefore the need for replacement, and sort of look at this initiation of a detox program, nutritional analysis, and then individualized treatment.
So let's talk about the nutritional analysis and the detox treatment.
So we've alluded to the toxic soup we live in. A ton of toxins, daily exposure to them. You know, people are unfortunately not making the greatest of dietary choices. They're eating food look-alike substances, and they've removed themselves from whole foods. They're engaging in behaviors that, especially my millennials, you know, they work hard, they party hard, so there's alcohol involved, there's not enough sleep involved, and even the individuals who have sort of gotten a sense that they need to eat better and are looking towards more organic and whole food choices are not getting the same macro and micronutrient content in the foods that they're choosing versus the foods that our grandmothers harvested from their gardens. Now, the very alarming emergence of information, even in allopathic medical literature, about ravages of glyphosate, the chemical found in Roundup, is really correlating with increase in a variety of things, from epidemic of obesity to cardiometabolic issues to cancer. And it makes it imperative to impart on our patients consistent and rigorous approach to seasonal cleansing. So even if there is no weight loss agenda for people, even if you're eating a clean and lean diet, we absolutely need to follow the seasons. And you know, in many cultures, Eastern cultures, that is a ritual, and we now have a reason for that ritual in our polluted Western world. So I recommend that we undertake this way of nutritional cleansing at least once in a season. And then, you know, what about nutritional support? Every patient's different, and it is very useful to know what one's nutritional makeup is like. Spectrocell laboratories utilize a methodology that allows us to see the inside of the cell, not just look at the serum values of specific nutritional vitamins and micronutrients and antioxidants. And it also provides us with a specific map of oxidative stress of an individual. So I very much like to get that information, and with it then can support the patient with appropriate recommendations. Once we've assessed that nutritional status, again, getting back to the hormonal eval, everybody should have a 4-point cortisol, but peri and postmenopausal women are also subject to other hormonal influences on production and or sensitivity or effectiveness of thyroid hormone, namely through disordered estrogen and progesterone metabolism, so I like to obtain a full hormonal panel as well.
Yes, so important. What about overall dietary recommendation, nutritional supplementation, or restrictions?
So, so then we get on a little journey with, choosing what I believe is the best underpinning of a diet program that isn't going to be one size fit all, but a core of it will be. After a 10-day dairy and gluten-free cleanse, primarily based on a rainbow-colored vegetable eating plan, I actually frequently recommend that patients stay as close as possible to that lifestyle, namely gluten and dairy-free and anti-inflammatory dietary free, because there is significant relationship between gluten and biosynthesis of thyroid hormones. And most people with autoimmune disorders are best served with nutritional recommendations that support a gluten-free lifestyle. Now, the list of thyroid supporting foods and supplements is long, and you've heard it many times before, but let's suffice to say that it is absolutely necessary to ensure adequate intake of certain vitamins. Vitamin D, which actually some will argue is really more a hormone than a vitamin, is incredibly important and needs to be measured, and not just placed in a satisfactory range. 30 to 100 is typical norm for most labs. 32 is compatible with life, but it's not optimal. So optimizing vitamin D into the 70, 80 range, very important. Making sure that there are enough B vitamins in the diet and or through supplementation. And many people ask me if I routinely test for TGFR mutations, but I like to, but don't always, because there is such a high incidence of impaired methylation that also correlates with autoimmune thyroid disease, that supplementation with high quality methylated Bs is also very, very important. Nutrients like zinc, selenium, and I am going to say and mention the controversial nutrient iodine. In iodine deficient Hashimoto's patients could be life-saving. Now, the challenge is, as I'm sure many of my predecessors have discussed with you, what methodology do we use for adequately assessing the iodine stores, etc. My recommendation typically is, if we find it on a urine or a blood test in a person who is not supplemented, to be in the low range, to supplement with lower end iodide combination to not precipitate the potential problems that many of the autoimmune Hashimoto patients have with excessive iodine. So that said, let's not forget about inflammation and inflammatory food, inflammatory influences of that food on our gut, and after the beautiful 10-day cleanse, let's not go back to our standard American pro-inflammatory diet, because unfortunately many of the systems depend on clean, and especially your gut. In the last 10-15 years, we've come to realize actually that just about everything that's important originates in our gut. As you know, most of the immune system, over 60% of it, resides in the GALT or gut-associated lymphoid tissue. So how can that immune system function properly if our gut is not functioning properly? Poor gut health is a significant factor in triggering autoimmune disease to begin with, as well as contributing to functional hypothyroidism, even if antibodies are not necessarily found. And I believe that in a certain percentage of Hashimoto patients, we can look and search but won't find, and yet they fit the profile beautifully in their comorbid conditions that put them in that category. So poor gut health depletes body of nutrients that support the thyroid health, and as we mentioned, zinc, selenium, tyrosine, vitamins A and D and B's are important, and therefore indirectly the biosynthesis of T4 and T3 is impaired. Unhealthy gut doesn't allow the proper estrogen or xenoestrogen excretion. So there again is that hormonal imbalance that results in now estrogen dominance. So what happens with that? Well, estrogen competes with binding proteins and thyroid binding transport proteins. So even if we have adequate amounts of thyroid hormones, they're not getting into the cell, they're not exerting their effect on a cellular level. So it's important to fix the gut because there are obviously so many watershed effects that we have. So what I like to do then is employ the 4R approach to gut health. Namely, number 1R is to remove the irritants, detox, and eat healthy. Number 2 is to re-inoculate. We all carry anywhere from 4 to 6 pounds of gut bacteria in our gut. Just a single course of antibiotics can usurp the beautiful microbiome that works very hard on generating all of the necessary components and ingredients of functioning human. And imagine it takes some repairing and re-inoculation of the good bugs to put them in balance with the bad ones. So probiotics, particularly combined with prebiotics, the food for the good bacteria, additional systemic anti-inflammatory agents, which will help heal the lining of the gastrointestinal tract, are usually my go-to when I'm talking about the re-inoculation. Now, replacement, what does that stand for? Well, it stands for replenishing the hydrochloric acid, which is so absolutely essential in appropriate absorption, replenishing the digestive enzymes, supporting the gallbladder, and providing the vitamins that are necessary for the optimum functioning of those. And then finally, the toughest thing for patients to sort of buy into is the long-term repair, because it is not easy. And whenever you talk to a Hashi survivor, you all have been there. You know that it took a lot of guts, no pun intended, to say no to parties, to say no to conventional foods, to say no to alcohol, to say no to a lot of social engagements, which in this country all pretty much rotate around spirits and food, and to stay true to your healing foods and gut support. But over time, and I always tell patients, this is not a short-term fix. This is really a lifelong challenge. Over time, we can get there, and we can get that vibrantly healthy gut, and from there on, or up, if you will, everything else ensues, so to speak.
Wow. A lot to take in. It's amazing. It seems, it appears that all the nutritional and hormonal aspects of our health are just so interconnected. And so maybe tell us more about how you test for hormonal competence and what's your approach.
Now to the fun part of kind of putting it all together, and this really is how all this works. The hormonal symphony. Low thyroid function is almost always secondary to some other condition. And we've mentioned adrenal stress, and I cannot emphasize it enough that responses to our being chased by a tiger on a daily basis so increase our stress hormones, cortisol in particular, and there is then this loss of communication between the adrenals and the brain, and there is sort of a lost message to the master gland of the body, the pituitary, which just does not sense things properly, and that communication is broken. So hypothalamus and pituitary go offline, if you will, and they typically are the conductors of that hormonal symphony. So when the hypothalamus and the pituitary weaken due to these mixed messages from overstressed adrenals that are not able to communicate well with other parts of the endocrine system, what we see is that, again, adrenal stress increases thyroid binding proteins, so T3 and T4 cannot get into the cell. There's also an adverse effect on conversion of the inactive T4 into active T3. And on top of that now, the cells are no longer sensitive to even the small amounts of circulating T3. Now, adrenals also relate to the progesterone. When they're continually producing cortisol under stress every day, the pituitary becomes sluggish from this overwork. And as a result, the reproductive system sort of suffers long term. And in women, we see low progesterone as early as, mid-30s, and a lot of that manifests as PMS and, or again, inability to conceive. There's low testosterone in men. And what do we do as conventionally trained docs? Well, look at the commercials. What to do about your low T? Well, we give men testosterone. Not the right thing to do. We're not addressing the root cause. Now, adrenals and estrogen, too much estrogen. We've already talked about the connection of xenoestrogens from environmental pollutants, plastic, etc., that contribute to the interrupted transport and biosynthesis of thyroid hormones, and not enough T3 getting into the cell and allowing it to function properly. Now, prolonged exposure to cortisol then runs down the liver's ability to get rid of those accumulated estrogens, and as a result, both estrogen and its metabolites, and some of which may have very adverse effect on human breast health, etc., circulate back into the bloodstream, become overabundant, and same thing occurs with thyroid binding globulins, and further then the thyroid hormones go down. So addressing the adrenal health via first getting to know your 4-point cortisol, and in the early stages of adrenal fatigue, cortisols are high, correlating with agitation, stress, anxiety, insomnia. But as we progress without treating the patient, they deplete the ability, the adrenals are depleted from the ability to produce the cortisol, and in the latter stages of adrenal depletion of fatigue, there is no hormone, and that's the patient who doesn't get out of bed. So similarly, exogenous hormones, which are prescribed abundantly to teens for, I love that, they say non-birth control reasons, treatment of acne or treatment of bad PMS. But those girls really do like the safe birth control methods. So some practitioners feel very comfortable prescribing birth control pills starting at menarche and stopping them essentially at menopause with an occasional break for pregnancy if desired. Now that formula may have worked 25 years ago or so, not anymore. We're seeing actually more and more young women who'd been on long-term oral contraceptives, when they get off of them, have a tough time getting pregnant. And some of that has to do with the exogenous hormones, which are probably suppressing the pituitary, and when pituitary is offline, the whole symphony is off. So there is that interconnectedness, very, very important for the patient to understand and the practitioner to kind of know how to assess and then what to do.
Yes. So let's look a little bit back. Can you give us a little summary of all your recommendations? Because you gave us a lot of information.
You know, as we live in a toxic soup, I think my first recommendation is detox and avoid environmental toxins and consume mostly plant-based organic diet as frequently as possible. Gut, clean it up. You know, clean up the gut. Now, balance the Th1 and Th2 arms of the immune system. Essential actually to clear the xenoestrogens and other environmental toxins which interfere with optimum thyroid hormone production. And you know, I used to be more vigilant in checking the interleukin 1 and 2 and other cytokines and teaching patients what type they are, if they're Th1 dominant or Th2 dominant. Really, it doesn't much matter. If there's dissonance and disequilibrium, we need to fix that, because without fixing the immune system and its balance, we're really sort of missing the boat. And then that's, again, gets us back to the gut. So detox, clean the gut, balance the immune system, support the HPA axis, support the brain, the pituitary. And I love providing adequate nutrition to the pituitary or master gland in the form of a secretagogue, a substance that is non-hormonal but results in hormonal balancing. So food for the pituitary, amino acids and botanicals can restore the balance of the director of the symphony, and the symphony hums by better production of end organs and organ hormones. Sleep is an incredibly important and cheap commodity. And until I was 40, 45, I thought that going on 4 to 5 hours of sleep was absolutely marvelous. It allowed me to be a super mom, a super doc, a superwoman. Well, consciously really brought myself to this 7 or 8, and for some patients even more, 8 to 9 hours of sleep, so our bodies can repair. So get enough sleep. Engage in regular practices of mindfulness, meditation, spirituality. Our mind, body, spirit is so important to be in alignment that no matter what I tell you to do or what you eat or don't eat, unless there is that connection, things are not going to hum and things are not going to fall into place as they ought to. Exercise is key, but very careful with exercise prescription, especially in my adrenally exhausted patients, because while once upon a time exercise made them feel great, excessive exercise with production of free oxygen radicals and reactive oxygen species may actually create more inflammation and give them a significant setback. So gauging the exercise to tolerance of patients and helping them build up that tolerance is important, but also reminding them to neutralize those free radicals with ample and appropriate antioxidant consumption. And, you know, last but not least, clearly many of the Hashi patients need to resort to medication, and if and when it's necessary for individualized treatment, I do. As I mentioned before, compounding thyroid is great, but some patients have done well with appropriately timed synthetic products, and I think that's the key because of the differences in the half-life of T4 and T3. But one thing to take away, I think, from this discussion is that one size does not fit all is the paradigm of successful medication treatment of autoimmune diseases that are seen in thyroid disease. So, you know, with that, again, individualization and looking at the whole symphony and the whole patient is my approach to a Hashi patient.
Beautiful.
Love it. Amazing.
So I think we are ready to open the lines for questions from the viewers. Let's see if they have some questions. Yes?
Should I be able to see that, or are you guys going to?
No, we're gonna read it to you, Dr. Vesna. Do you want to take the first one?
Sure. Yeah. And everyone, feel free to start asking questions now as well. The line is open. Okay, so I have recently been diagnosed with Hashimoto's, but my question is about my daughter that has low T2 and has attention issues and has been diagnosed with bipolar. Can some autoimmune diseases cause some bipolar symptoms?
So, you know, pediatrics, not my specialty. However, what we're seeing in younger and younger patients is, again, emergence of autoimmune diseases. What statistic that I am familiar with is one of autism that clearly is linked to toxic exposures, and it is now as high as 1 in 49 in some states, but it's typically about 1 in 60 across the nation. Along with it, we are seeing some behavioral and mood disorders as well. In a young child with a bipolar disorder, I think I would look for underlying nutritional or autoimmune issues, as well as really try to clean the diet and look for toxic exposures as well. For every mother who is faced with probably a medication choice in a young child and or a diagnosis that follows them their entire lifetime, it's important to validate the diagnosis, but it also would behoove you to work with an integrative nutritionist, to work with a specialist who can look at functional neurological testing of the brain, because there's certain deficiencies that may mimic as depression, anxiety, and or bipolar that can clearly be noted on brain imaging, and activity of the brain can be followed, and the abnormalities reversed with initiation of appropriate lifestyle changes. So again, not my specialty, but I would urge the mom to look into functional neurology and or functional psychiatry and actual imaging studies that would sometimes light up in the areas of the brain that traditional medical community would medicate, and oftentimes nutrition and clean lifestyle can completely eradicate.
So the viewer that was asking the question just added that she's 19 years old.
The young woman is 19?
Yes.
Okay. You know, same is true. Same is true there. Cleaning up the teenagers' diet is not always the easiest, but you know, going as clean and as organic, and again, looking at reversible causes of a psychiatric disorder is certainly a first step that I would undertake.
Great. We have a question from Suzanne. How do I find out what the correct amount of vitamin D, probiotics, thyroid replacement, glucosamine, calcium and magnesium, vitamin B12 should I take on a daily basis?
Okay, well, that's a loaded question there, right? And you know, this is a great question because so many of my patients come to me literally with suitcases or backpacks full of pills. And you would think that they're getting adequate levels. It all depends on the type of nutritional supplement, how it's absorbed, why it's not absorbed if it isn't absorbed. So I would definitely start with taking a look inside. So first and foremost, knowing where the patient's nutritional status is, and I like SpectraCell because it gives us actually a value of what the nutrients are like within the cell and not in the serum. Because it's a sophisticated test that takes your own blood, grows your own T cells and culture, and incubates them with a variety of different nutrients, and then finds the sweet spot, if you will, where your cells are thriving, and that's where you should be. And if you're below that or above that, you're too toxic or not had enough. So, you know, conventional RDA requirements are really to basically sustain life without you dying. So they're certainly not optimal. And the perfect example here is even if we measure the vitamin D level, the range is so huge for most laboratories. I use Quest Laboratories, and their range is from 30 to 100. Is 31 normal? Yes, it is. Is it optimal? Absolutely not. So for certain conditions, including getting back to the first caller, neuropsychiatric functioning is found to be markedly improved when we push that vitamin D level in the 70s, 80s, even 90s. And toxicity is seldom seen unless there's sustained exposure to high doses of vitamin D in excess of 200. So again, for some vitamins, we can definitely measure them conventionally, find the sweet spot, and then, you know, individualize based on that. But the intracellular analysis, and then that particular test also gives us something called antioxidant index, which is ability of our cells to deal with oxidative stress. And oxidative stress is one of the things that ages us, that actually creates, that shortens our telomeres and changes our chromosomes. So it's very useful and good to know where we stand. I'm not sure that I answered that to your liking, but you know, that would be kind of my approach.
Great. She also asks, Suzanne says, what can I do right now to help with my hair loss?
With hair loss?
Yeah.
So I think that, you know, as we've talked, it's multifactorial, and replenishing the nutrients that are missing, getting rid of toxins, big, and addressing the dysbiosis and the imbalances in the GI system. And of course, there are many vitamins and many companies that are touting and targeting and pointing to their efficacy of hair loss and skin and nail vitamins. There haven't been many that have actually had clinical trials, and one has, and this is really not a promo for any products or any companies, but there is a company out there that has skin and nail product that has been studied that actually has been shown to be helpful. Some other non-nutritional support to enhance the regrowth of hair that is actually gaining some traction, and it is completely safe, is PRP therapy. PRP stands for platelet-rich plasma. And our own platelets have a lot of growth factors. So some hair restorative physicians are offering this type of treatment in alopecia of both male and female type, where those growth factors that have been harvested from our own cells are actually, without any ill effects, stimulating the regrowth of hair.
Thank you, Dr. Vesna.
Yes.
We have a question from Ingrid. Where do I get the proper testing to determine if I have Hashimoto's or a similar autoimmune issue?
So as we were talking, you know, there are some tests that are easily done by conventional laboratories, by conventional doctors. They just need to be prompted. An integrative medical practitioner will not have to be prompted, and she or he will order the testing that we've talked about, namely the levels of free circulating thyroid hormones, free T3, free T4, thyroid stimulating hormone, the antibodies, TPO and anti-thyroglobulin antibodies, and sometimes reverse D3. So that would be a panel of thyroid tests. But then, you know, as I mentioned before, where one autoimmune disease lives, look for other issues and other particularly hormonal disturbances. So a 4-point salivary cortisol is very useful in addressing the adrenals. Now, if there isn't an integrated practitioner in your area, there is a lab that I use and like very much because it is the premier and leading saliva lab in the country called ZRT Laboratories. They also do something called blood spot and saliva testing, where a patient you can go online, get a kit, and actually do your own testing, but then they will provide some interpretation of the results. However, I always urge if patients go that route to then find an integrated practitioner who can help them individualize the approach to treatment.
Can you explain the 0.4 or the 4-point cortisol, like what that means exactly?
It's 4 times during the 24-hour period. We spit in the tube. So as I think one of the genetic commercials out there says, ladies don't spit, well, you really are going to have to work hard to produce saliva first thing in the morning, and then midday, 12 noon, between 4 and 5, and then at bedtime. The advantage to the salivary hormonal assessment versus serum assessment is several-fold. First of all, it allows us to recognize biologically available free hormones. Second of all, it saves you 4 trips to the lab. And I dare you to find a Quest lab that's open at bedtime. And then there's actually something physiologic that can happen when we, even with a small needle puncture a vessel, our stress hormones can go up, and you can actually get a false temporary increase in cortisol. So if you're depleted, you may look like you're normal. If you're normal, you may look like you're elevated. So for that reason, I really almost 100% rely on 4-point salivary cortisol.
Great, thank you for explaining that. And Madhu says, thank you. We've been struggling for 5 years with this issue, which is the woman with the daughter of 19. 5 years with this issue, and traditional medicine is not working. I appreciate the seminar.
Well, be vigilant, and I'm happy to at another time provide some references to colleagues who have done remarkable work mapping the neurochemistry of the brain and looking at the functional approach to neurological and mental health.
Thank you. We have a question from Tammy. I've been diagnosed with Hashimoto since I was 29. I began perimenopause at 38, and I was tested and found that I was in full bloom menopause at 44. I have not had a period over 4 years, and I was recently told I had anemia. I've had history of anemia. Is there a correlation between autoimmune disease and anemia? My physician has never really given me much attention, but as an exercise physiologist, I need to have full access to oxygen.
Indeed, and actually there is association with thyroid disease and anemia. There is also an association, as we mentioned before, between thyroid disease of autoimmune type and premature menopause. Now, menopause at 44 is technically not premature, but having started it or in your 30s, you have started the journey certainly very young. And as we pointed out before, it is really important to balance all of those hormones and nutritionally support you, in which case there might be answers to the anemia that goes beyond just the association that is seen with autoimmune thyroid disease and anemia. So full investigation is appropriate if nutritional support has failed to correct it.
So the next question is from Malgorzata, if I'm pronouncing that correctly. Hello, so I have been diagnosed with Hashimoto's 2 years ago, and I would like to know what is the appropriate dosage I should take if my TSH is 8. Currently, I am taking 90 mgs of the thyroid. Is this the right amount of it? Thank you.
So that's where things get tricky, because if you recall, you know, we've talked about individualizing approach. Without longitudinally knowing what your treatment history has been, I couldn't really specifically address that. But suffice it to say that both the TSH and measurement of T3 and T4 and autoantibodies can vastly oscillate in the course of treated or untreated Hashimoto's thyroiditis and hypothyroidism. So that is where the treatment gets tricky. Obviously, you need more because the TSH of 8 is not showing appropriate response. Now, do you need more, or do you need to clear your receptors? Do you need to make sure that exogenous thyroid hormone is actually getting into the cell and doing its job? So remember what we talked about in that hormonal symphony. Is there too much xenoestrogens flowing around, and is there competition for thyroid binding globulin, so that even the thyroid that you are taking is just kind of floating around and not getting inside of the cell where it needs to exert its effect? So really looking for all of those comorbid conditions, if you will, would be the way I would proceed if I see a patient in whom, you know, I'm escalating the dose of treatment and nothing's happening, or the TSH is barely budging.
Thank you. Let me just check with you, Dr. Skul. Do you want to take one more question? I know it's already 9:20 almost.
So one more question is fine for the road, right?
All right. So a question from Julie. So many folks do all the right things. They detox, they have great diet, work on stress reduction, exercise, yoga, etc., and still are unable to crack the code and regain their health. I know you have had great success supporting and treating women in becoming radiantly healthy with Hashi. What are your thoughts on this?
Oh gosh, Julie, out there, you just described a second patient of my day today. I had, so let me share her story, and maybe that will answer your question. I saw a lovely 32-year-old woman who you know, was seemingly healthy when I saw her a year ago. A busy professional, referred to me by an aunt of hers, age 56, who had Hashimoto's, and after a struggle had actually gotten herself in remission through my comprehensive system approach and hormonal approach. So patient who we will call K, which is the first initial of her name, after a workup that we've done, it was determined that she was not only hypothyroid, but had severe adrenal burnout. So her adrenal curve was like almost completely flat. She actually saw a respected endocrinologist. They put her on Synthroid, and they even added a little T3, even a little Cytomel. So she had a beautiful 6 weeks of improvement, and then what I told you earlier happened, and she crashed, and that's when she saw me. So a year ago then, we started looking at the complete hormonal symphony for Kay. We looked at her diet, pretty clean she was, but she needed very aggressive GI support, which was provided. She started practicing daily meditation, and you know, was self treating with what seemed to be appropriate supplements until she got to me. But as we mapped her road to recovery, I really basically told her to put away a backpack of her supplements, and I tried to simplify her nutritional support, because what happens very often is becomes so engaging and so overwhelming that even though a patient feels better, they can't keep up with it. So we basically stopped her oral contraceptive, which was contributing to her estrogen dominance and poor clearance of estrogen. We helped balance her Th1 and Th2 system, which also, by the way, helped with her seasonal allergies, with an immunomodulator. She is enjoying benefits of B vitamins, vitamin C, and liposomally delivered blend of B vitamins and adaptogenic herbs, and her adrenals have recovered dramatically in the first 3 months. And her HbA axis has been supported by a secretagogue, basically a blend of amino acids and three botanicals, which has improved her sleep, her focus, her concentration. Brain fog is gone. Her diet is clean and remains to be. So month 3, she is probably 50% better. Month 6, so I see patients like on a continuum. And today was our anniversary visit. And at our anniversary visit, Kay was vibrantly beautiful, healthy, new job, new blog, blogging about her health and empowering other women to really take ownership of their own health, and essentially dismissing me because my job is done. I have created a self-sustainably healthy, radiantly healthy patient who now can just touch base with me once a year, and that really is fulfillment of my goal as an integrative practitioner. So thanks, Julie, for asking the question, because that really kind of describes what I see myself in doing, and that is facilitating optimum health through awareness, consciousness, and self-help.
Thank you so much.
Well, thank you. This has been fun, and what a company of great folks beforehand. Looking forward to the summit, and to be available to viewers if they have any additional questions through Fabienne and our dear Pearl. So
yes, we will forward that to you, Vesna, because there's a few more questions, and so we don't have time to answer them, but we will address them in an email. Thank you for being with us, everybody. Thank you for, I know we took longer than usually. Thank you for that extra time. So visit our website, heyhashi.org, and register for the free summit coming up November 6th to the 13th. And what else?
Thank you so much, Dr. Skul. Yeah, that was so riveting and just so eye-opening for me, and of course all the women out there. So thank you for being with us.
Yes, when I met Dr. Skul, I was in remission from Hashimoto, and I was about 85% or so, I would say. And I can't thank you enough for taking me, to that extra step that I was kind of stuck, you know, I just couldn't get there. And I'm so grateful to you for taking me where I wanted to.
Thank you for inviting me to share. And, you know, it's all about really taking the women who've done the work, who've been on the journey, and helping them find the refinement on the cellular level, cellular detoxification and hormonal alignment. So it is so rewarding to see you glowing and to see all of my patients thriving. It's a great but challenging work that we all have together.
Yes, and it's never finished, but it's okay. It gets better.
Yeah.
So thank you, everybody. Have a great end of the evening, and we'll see you soon.
Bye.
Good night.
Good night.